Let's move on to our next question. Is occupational therapy a necessary intervention for children with ADHD or attention deficit hyperactivity disorder?
Yes, it's definitely a yes. Children with ADHD, they usually exhibits one or more of the following difficulties, and which I will list it below. But because of these disabilities or these difficulties, the children with ADHD, they definitely need occupational therapy. So the first one is like, the developmental delay, usually not reaching out the developmental milestones of sitting, crawling, walking, not learning at an appropriate level or at an appropriate age, not developing age appropriate play and other social skills. So this was the first one. The second is like, as we talked before about the fine and the gross motor skills, manipulating the toys and the puzzles, holding a pencil, using straws at age appropriate, using scissors, zippers, all the ADL, like, coloring between the lines. These are all the basic skills that are required to function at their age. Other things usually when we see is like, poor, the parents come with a complaint of poor handwriting, not developing a hand dominance, avoiding the task and the games that require a lot of fine motor skills. And so usually, like, when they are not coping up with the skills, that usually avoided by the other peer groups, which leads to lack of self-confidence. And then there are more of behavior issues that come up. Even that should be taken into notice. And some of the other gross motor activities, which are going up and down the stairs in an age appropriate time, coordinating both the sides of the body, understanding the concept of right and left, poor ball skills, balance skills, which all we talked about, like, the gross and the fine motor skills, which usually the OT works on. We usually see this difficulty with ADHD kids. The third one is like the visual processing. Usually they have difficulty with spacing and the size of the letters, recognizing the letters, copying the shapes, copying from the board, difficulty using a cup in an age appropriate, like, the child is not able to like even see the where it is the location or the spacing. It again involves the visual spacing, finding the object among the other objects, copying from the board or another paper, the concept of right and left, and many more. Like, these are the examples of the visual processing, and usually that's seen in the ADHD kids. They also have difficulty with their oral motor and the oral sensory. There is excessive of drooling, difficulty with drinking from a straw at an age appropriate time, lengthy bottling or a breastfeeding. They are usually tired after eating due to like continuous chewing. They have difficulty with chewing as well. There is like excessive liquid, like from the drooling of the liquid from his or her lips when the bottle or the breastfeeding. The child who loses excessive liquid or food from his or her mouth when drinking or chewing. It's like the same that we talked before is also a part of the oral sensitivity. Like, there are parents who come to us that my child is very picky in eating. So it is also because of the part of the sensory processing, which is related to picky eating. So that's the reason he needs OT, because usually it's not like, the child is picky eating, then we are just working on the eating part. But, it is also related to the sensory part. If we provide the child with appropriate sensory stimulation, we are indirectly working on his picky eating. So this is the one thing that is like not lack of awareness. Like, if the child is picky eating, we usually like to just make him eat food or give him some oral stimulation. But the other sensory stimulation, it also help him with the difficulty with picky eating. And the next one is with also mouths or toys, like, putting the excessive mouthing of the objects and toys and beyond his age appropriate time. Like, there are some parents who say that, oh, my other kid was also mouthing objects, he was doing. But there is a period or age when the child, there is an oral stage, like over oral development. But your child doesn't do it after a particular age or a particular time. So this is very important. When, like, when you compare this with the other kids, it's very important that, there should be integration of all these skills at one age.
Yes.
The other is the play skills, which is very important. Play is like an occupation. Like, we are an occupational therapist. Occupational therapists usually say, like, occupation. We work on their occupation, and their
Yes.
occupation is play. We
Yes.
actually work on their play skills. And if their play skills is affected, like, there are so many other things they are going behind. So,
Yes.
they need adult guidance for the play. Like, they cannot initiate the play. There is
Yes.
a lack of imitation, and they just wander around when others are playing. Like, they just don't socially interact, or does
Yes.
not explore voice appropriately.
Yes.
They does not understand the concepts of taking turn or sharing, or participating in repetitive, like, they participate in repetitive play hours, or just
Yes.
lining up the toys. So it's not a meaningful or a purposeful play. So again,
Yes.
like an occupational therapist, we work on the play skills, making it more meaningful and purposeful for the kids.
Yes.
The next is the learning challenges. Usually the ADHD kids, they usually come with a complaint of hyperactivity and attention, as the name
Yes.
says, like,
Yes.
attention deficit hyperactive disorder. They definitely find learning challenges, because the first thing is they cannot sit at one place. So it's not that, they have any intellectual incapability, or they are not able to function properly. It's not about that. About, like, they are finding it learning difficult because lacking of other sensory difficulties. So,
Yes.
like, they are not able to concentrate and focus, and that's the reason they miss out lot many things. They are not able to take out the sensory stimulation that's provided from the environment. So when you're not able to take the information, you won't be able, and you're not able to process it, you are not going to give the 100% response, or you're not going to give your 100% result.
Absolutely.
So so the learning is, the challenges is, like, they get easily distracted, they get tired easily after the schoolwork. They have the poor impulse control. The poor impulse control also comes because of the lack of confidence, because earlier we saw, they are not able to cope up with their other peers. So there is a lack of confidence, leading to poor impulse control, poor getting difficulties with their behavior, not keeping up with the workload at the school, and making the reversals after, like, after the age of 7. Usually there are kids who show the reversals, which is okay. But you show reversals even after the age of 7, then you definitely need help. And the next one is the social interaction skills. It's like difficulty interacting with the other peers socially, and engaging with the family and the peers. Usually the parents, they come and say that, no, he is very good with me, he's very good with the family, socially interacting, but he's only socially interacting with the person he knows, he is comfortable with the adults. When it comes to the age, so there is no one reason to it, but there are a lot many sensory difficulties or sensory processing difficulties that is not allowing him to socially interact.
Yes.
So that's very important. Like, they also have difficulty adapting to the new environments, and overly focused on one subject, always want one subject. And, like, they have a very, they can't cope up with the environment, and leading to a lot of frustrations. So if the child exhibits one or more of the above difficulties that we talked about, then he definitely needs occupational therapy. So I would say, like, the sooner you start, the more benefit you get.
Yes. Thank you so much for that answer, Kathy, because from what you're saying, what I can understand is that when a child exhibits, as you were saying, if a child exhibits the sort of primitive play, which is like sensory motor play, when they are still mouthing things even after the age appropriate level, and also when there is this difficulty with integrating all the senses together, that's when you see difficulty with eating, with movement, fine gross motor movement, with learning. So that's how important it is to have that integration of senses for a child to learn.